Up next, our next guest is Dr. Audrey Baumeister. Dr. Baumeister practices with Dr. Hoffman, whom I met during my initial diagnosis of Tourette's. Dr. Audrey Baumeister attended the University of Florida for her undergraduate studies, where she participated in research and authored publications under the Department of Psychiatry, which has specialized in the treatment of obsessive-compulsive disorder, OCD, and tic disorders for over 20 years. As a doctoral student at Louisiana State University, her specializations included parent training, assessment, and treatment of attention deficit, hyperactivity disorder, and learning disabilities, as well as group counseling for teens. While attending LSU, Dr. Baumeister also authored publications regarding the assessment and treatment of neuropsychological disorders. Following graduate school, Dr. Baumeister completed her internship at UF, where she conducted neuropsychological assessments of children and adults, provided parent training, and worked in the intensive OCD clinic. Currently, as a licensed psychologist at Neurobehavioral Institute, Dr. Baumeister, specializes in anxiety disorders, including tic disorders, and leads the monthly Children and Families OCD support group at NBI. Welcome, Dr. Baumeister.
As Kelsey said, I'm Audrey Baumeister, and I'm one of the clinicians at the Neurobehavioral Institute in Weston, where we specialize in pediatric OCD, ADHD, and other anxiety disorders, and of course Tourette's. And we're an evidence-based clinic, which means that we implement therapies and provide strategies that are research-based and have been studied in the universities, published in research journals, so they implement or re-implement the state-of-the-art treatment for Tourette's, and that's habit reversal training. And I'll describe that in a nutshell. It's a 3-step program that has 3 different components, and one is building awareness of the tic, so we work with kids and help them understand what's going on and notice when it's occurring. And we also work, I'm sure Kelsey knows all of these things, we work on developing awareness of the premonitory sense before the tic occurs. So sometimes if people have a blinking tic, they'll experience tightness in their eyes or a dry sensation, and then they'll blink really hard to alleviate that feeling. And so we build awareness of that, and then we implement a competing response, which is the 3rd component. And there, people often say, well, if I implement a competing response, which would mean instead of blinking hard, blink soft, wouldn't I just get stuck doing that? But the way that the brain works, it turns out that that actually starts breaking the connection and eventually makes it easier to resist the urge overall. And as you've mentioned, it's not just Tourette's. There are often other comorbid conditions that once those are addressed, it's much more easy to combat the symptoms. So those are important pieces. And when it comes to an academic scholarship, I think it's such a phenomenal idea, because you think of high school students studying for the SAT and the ACT and trying to figure out how am I going to afford school, and then they can earn a scholarship for overcoming adversity with battling tic disorder. I think it's fantastic. So it's wonderful to be a part of this, and it's a great idea.
Thank you.